right, welcome to the Maltrend Studio, and today with us is a doctor, right? And we're about to unravel something very, very special, right? It's an endemic, and we just want to, break it all down and sap out the juice from all that, all that our doctor has to say. So with me is Dr. Emile. Sir, please can you introduce yourself?
Thank you very much for having me, Olamide. I'm Dr. Erinle Oluwaseyi. I'm, uh, I'm a resident doctor in the Department of Family Medicine in Federal Medical Center in Butemeta. That means I'm training to be a family physician. Yeah. I have about 4 to 5 years of experience practicing as a doctor, and of course, I'm passionate about healthcare, passionate about preventive medicine for the most part, and I'm confident that the little knowledge I have and a few years of experience I've been able to, I've been able to gather, you would benefit from this conversation uh, at this podcast. So, thank you for having me once again on this podcast. Biotrend, I think you're doing wonderful, an amazing job, Molamide. Thank you for having me.
All right, thank you so much. Thank you so much. Yes, we are glad to have you here, and we are ready to use our questions to disturb you. All right, so let's start with the fact about. So today we are talking about Lassa fever, guys. We're talking about Lassa fever, and for us, we feel a lot of people just say, Lassa fever, Lassa fever. Well, we don't really understand what Lassa fever is. So, doctor, if you would want to help us, right, to the general public, what is Lassa fever? In the simplest way they can everybody can understand, including me. What will you say Lassa fever is?
Okay, so Lassa fever is an infectious disease, and we call it a one of the viral hemorrhagic fever. Okay, that we have. The word Lassa you find there is simply gotten from the town in Borno where this virus was first found. Okay, and then fever simply means the illness is characterized by an increase in your body temperature. Okay, that's where those two words were coined from. And then I also said
Mm,
viral hemorrhagic fever. This means it can affect the body to the point that it causes bleeding from certain parts of the body. That is what hemorrhage is, bleeding. Okay, so what are the takeaway? Number one, it's infectious, caused by the Lassa virus, and then it affects the body to the point of causing bleeding from certain parts of the body. And um, okay, I'll talk about the mode of transmission, I think, a little bit later, but those are the things you should know about Lassa fever for now.
all right, thank you so much. That's beautiful. So we know that Lassa fever actually was found out from the town where it was first discovered, and then fever because it affects the body temperature. So really, I'm particular about that mode of transmission because how do we humans come in contact with Lassa fever, right? You made mention of the mode of transmission. How do we come
Okay.
about it being and is it communicable, right? Is it a
Yes.
communicable
So like I
disease?
said, yes, like I said, it's an infectious disease. Yes, it can be transmitted from um, vector to host. So that means from the vector in this case. In the case of Lassa fever, the carrier, the vector is a multi-mammit rat, which we call Mastomys natalensis. Okay, a particular kind of rodent. So it can be transmitted if there is a rodent that is infected with that virus. You can imagine that that rodent will deposit that virus either through the urine or coming in contact with foods that will be consumed by a human. Okay, when that happens, there is likelihood of transmission of that virus. Okay, and it can also be transmitted through an infected individual. So if someone already has Lassa fever, you find this more in the healthcare setting. Um, Someone already manifesting the symptoms of Lassa fever and maybe not quickly or not diagnosed early. Um, those who come in contact with that individual, are at risk of also contracting it. So we have the primary mode, which is via um, the rodents, fecal oral routes. I mean, taking in foods that are contaminated. And we also have what we can call the secondary way of infection, which is from human to human. Body fluids, essentially. So, urine, we're talking about blood for the most part. Um, those are the means through which this can be contracted. Yeah. So it's very communicable, highly communicable. It's a viral infection, and um, we need to do everything that we can to actually prevent it from happening.
Okay, so like we can hear our doctors say, Lassa fever is a communicable disease, right? It is not like
100%.
malaria that it is only, oh, it's the vector that gives the host and, well, from a host human to another human, you can't pass malaria. Lassa fever, from human to human, you can actually pass it because, according to him, he said it is a viral infection and it is highly communicable. So we need to be more careful. So aside from we made mention of the fact that the name is coming from Lassa fever. I believe for them to actually pick fever as its symptom, will you say fever is a major symptom for this particular illness that we are endemic that we are discussing today? And are there other
Yeah.
symptoms that you would identify and say, okay, I think these are also symptoms that the general public look out for? Um,
Okay.
yeah.
Yeah. Thank you. Thank you very much. Thank you very much for that question. You mentioned endemic, and I think I skipped that. At the initial, the, the very first question. So let me just rewind to say that yes, Lassa fever is endemic to certain regions, specifically West Africa, western part of Africa. So you find Nigeria in that area. You find Liberia. You find which other country again? Those countries in West Africa, right? That is where that is where Lassa fever is endemic, and the reason is because these Mastomys natalensis, those rodents, they are predominant in this region. Okay, it's unfortunate, but that is what it is. Our weather condition actually favors that. Okay, so to your question now,
Mm,
fever is an ominous sign. What that means is that you should not, one should not under, one should not underestimate or underrate fever that is not,
overlook.
yes, yes, overlook. That what I mean. Overlook, sorry, not underlook. I beg your pardon. So you should not overlook fever that is not coming down after the use of over-the-counter medications, after taking your paracetamol or ibuprofen or any of those medications that should bring down fever. If it's still not coming down after a couple of days, getting to a week, you should not even wait a week. Okay, sorry about that. Life should be restored shortly. You should not even wait to a week. You should report to the hospital immediately. So the most common conditions that the average Nigerian or those in this part of the world in West Africa would think of is a malaria infection. Sorry. And after treating malaria, for example, 2 days, 3 days, the symptoms still persist. And what are these symptoms that can mimic this malaria? You can just feel like you are not well. You feel unwell. We call it malay. You can have generalized body weakness. That means you just feel sick. Okay, and maybe headache is also one of it. Some may have sore throats. Okay, so those symptoms can make you think, okay, it's just the regular, malaria. Maybe I was bitten by an infected female anopheles, and then you go ahead to most of the time, the average Nigerian will not even bother to do any test. You just go and get one donut there or quarter there and stuff. Well, it's not best practice. Okay, but if after doing that you still feel unwell, then it's a cause for alarm. You should present to the hospital. However, there are other symptoms that would further nail the diagnosis of Lassa fever, although this usually happens later. So you find that um, like in the second week most of the time. Okay, this is where patients begin to have symptoms like chest pain, they begin to cough, begin to have vomiting, diarrhea, and then begin to bleed from openings of their body, bleed from the eyes, from the nose, from the mouth. Some guys won't bleed via their urine, bleed of, women can bleed as though they are seeing their, menstruation. But this is happening because the virus is beginning to multiply in the body and is beginning to affect certain blood cells that is now leading to bleeding. Okay, so like I said, the initial symptoms might appear vague, might be confused with other infections, other diseases like malaria, maybe even a common cold or a strep throat. But one must not overlook those symptoms if they persist. Should present to the hospital to be properly and adequately examined and checked. Yeah.
Okay, so you made mention of something because I have a lot of questions, but let's pick it from where you started from. Simply your answer will also bear more questions, and then I will forget this other ones that I have. But there was a
Uh,
particular thing you made mention of. You said on um because of this rodent is found more in this part of the world. That is why Lassa fever is categorized as an endemic. Do you think this is the only reason why there is a persistent problem over the years with Lassa fever cases, especially the rise in Lassa fever cases, or there are other reasons aside from, you know, this rodents being present that could be the reason why we have this persistent challenge in this part of the world?
well, so I said that the weather condition actually favors the what favors the survival of anything to say in quotes and the abundance of these rats. Okay, that is on one hand,
Hmm.
and secondly, I would say if we are not able to get rid of these rodents, okay, if we are not able to get rid of them, if we are not able to reduce the interaction that humans have with the rodents, then we simply cannot. I don't know how we will defeat Lassa fever. It should be prevented. Modes of prevention should be what we are aiming at, rather than, of
Hmm.
course, that is on one end. That is the primary way of prevention. Before we now start talking about diagnosing early and treating promptly. Okay, but I do not think that we would actually see an end if we don't. find a way to eradicate those rats. And I really do not know how we are going to be able to do that. Maybe you will tell us as as the climate
I was expecting that.
expert. Do you
Oh,
understand? But
well,
of course, but of course, he said, what is it?
no, no, I'm with you. You said, but of course.
I
No,
didn't
I
hear.
listened.
Yeah, yeah. So getting rid of the rodents is very important, and then we as inhabitants of in these we who live in these regions, we must um, be very wary and be mindful of the fact that, especially if you live in a region where there are bushes all around, and you practice there are so
Hmm.
many practices that has to do with tampering with the ecosystem, maybe bringing down trees, deforestation, burning of bushes and all of that stuff. You are going to be at risk of coming in contact with these rodents. And when that happens, you know, you may just be exposing yourself to certain rodents that are infected with this virus, which is not good. Okay. So yeah, those are the factors I would say that at play. Um, except you have something to add to that.
Well, I think you really touched major things. I feel the concern on climate is something general. It's not just this part of the world. And our weather patterns were quite predictable a couple of years back. But I believe the narratives are changing. Um, but I believe for every trial that we experience around the world is because there is an innovation and there's something new that would make things get better than the way they were before. So, yeah, we are quite open minded, but we are not talking about climate today. Right, we're talking about Lassa fever. We're talking about Lassa fever. So interestingly, I think a lot of people, a lot of focus is on this rodent to humans, not really the human to human. Why is that? I mean, the
Because
mode
the
of
human will not get
transmission.
it.
A lot of
because
focus
the
is
because the human will not get the virus in the first place if not exposed to an infected rodent that has now passed it on, deposited something in the food, maybe due to poor storage and all of that stuff. So the focus should actually be um, forestalling it at the first point of contact, which is from the rodent to the human. The human is not going to have the virus in the first place to transfer to the human, if you understand what I mean. If it has not first, gotten it via
Mhm.
a food, via food that is infected, which must have come from this rat. This, pardon the lightning, I believe it is restored soon. So yeah, that is why I think the focus is more with limiting the humans rodent interaction. You find the human to human more in the healthcare setting, in the hospital setting. Okay, and usually the healthcare practitioners who come in contact with these patients are the ones at risk, if you understand what I mean. But if we are trying to campaign and we are trying to educate the general public, the emphasis should be on the rodents and, of course, timely, presentation to the hospital so that one can be properly checked and examined.
Okay. Okay, so I have a internal memo here from the University College Hospital Ibadan, right? And I'm just going to read maybe the first paragraph of it. Right. So it says the management wishes to use this medium to remind the hospital community of the endemic nature of Lassa fever in Nigeria. Cases are reported year round, particularly peaking during the dry season, November to April. The virus remains a persistent public health challenge, with the causative agent being transmitted through food or household items contaminated with urine or feces of this rat that we mentioned, that doctor mentioned earlier on. And went further to say recently a patient was admitted to the hospital who unfortunately passed away while being cared for. And then also, let me just summarize. This is that other members in the hospital are being quarantined currently. So we really want to move to the trend of Lassa fever. So really, Lassa fever is something really prominent in the northern parts, Borno State, some cases in Edo State, but we have lesser concern in the western part of Nigeria, like Ogun State, Lagos State, Oyo State, and the likes. And this memorandum I just read was actually released 15th of April. Currently, the people who treated this person are currently quarantined. What does this mean to the general public? Is there should we be preparing to should we be more aware? Are there measures we need to put in place? You know, for something that it's not very common in the western part, would we say, aside from even the health practitioners like the doctors, is this a concern to the government? Is this a concern to researchers? What would you denote as a doctor from this memo?
Okay. Yeah. So I mean, sad memo, I would say, because I want to believe that if proper measures had been put in place, as of course on the side of the individual, I don't know how he got infected. But I want to believe is I want to believe that most likely it was at the point of that of the human rodent interaction. The measures that ought to have been put in place, maybe, or I would say most likely, were not put in place. I don't know where he purchased the food that he ate. I don't know how he stored his food and all of that. But well, long story short, unfortunately, that the patient is no more. And that's another thing with Lassa fever.
Mm,
You see, before you can nail a diagnosis, the definitive diagnostic test that is to be done usually via a specific um, we call it a PCR testing for Lassa fever, a polymerase chain, reaction, that's actually will specifically pick a particular antigen, okay, which this Lassa virus, has. It takes some time before that result comes out. It takes some time, which is again why I'm going to re which is why I'm going to emphasize, reiterate the need to promptly visit the hospital when you have symptoms that you don't understand. I don't know how soon that individual, visited UCH. I don't know how many weeks he was trying to, treat malaria or treat some symptom. I really do not know what the presentation was like. Okay, but
mm,
the general public, of course, we need to have every one of us now. We need to have a high index of suspicion. We need to, whenever there is fever. In fact, you can't be wrong by thinking Lassa fever first. And what that means is that get a malaria test done. The common things, of course, rule those ones out first. If there's no malaria, then you should be thinking, what else, can this be? Okay. For that individual to have passed on before his test, the definitive result of the diagnostic test was out, it means his case actually deteriorated quite fast. Okay, it means, can you still hear me? It means that the symptoms became severe. Probably had the chest pain and started bleeding, and then because of maybe even bled into his brain, who knows? Maybe he had respiratory symptoms that affected, that affected his respiratory physiology and made him decompensate. Who knows? Do you understand? Those are the most likely things that would have led to, his demise. Okay, so it's good, that's the best step that I've been taking to quarantine those who were in contact with the individual that had Lassa. That's how to go about it, so that we will be sure that they are not also moving about and transmitting it to people. Okay, so that brings us to what we call contact tracing. Yeah, it will also be important to trace those who have come in contact with that individual person that died of Lassa. Those that brought him to the hospital, for instance, his family, if he was a student, his hostel, those that, and even the place where he lives and how he stores his food, how and where he buys his food from. All of those things and all of those places need to be checked. Okay.
The general public
Yes.
should have a level of high suspicion now.
Yes.
You said
And then I
something
was
like, okay,
saying,
even if you have
before you,
fever, you should think of Lassa fever.
yes, and then when I also added that I'm not sure, but I think that individual is actually a student because I heard it was from UI or something like that. It means if that's the case, it means that's hostel. Okay, whoever sells food or whoever does anything food storage in that region should actually the such person should be checked. Okay, and they must ensure that proper measures are put in place to make sure that the food storage is adequate and free from reach of these rodents. Okay, I said that it's a very good step, very very important step that has been done to quarantine those medical personnel who have come in contact with that patient, that individual who unfortunately is no more. Okay, and that is what contact tracing means. That means we should be able to actually trace those that brought these patients to the hospital, his family members, or those that stay with him in the hostel, and trace like that, so that we'll be sure that none of those persons, um, have contracted that virus and just waiting to manifest. Okay. Remember that there is an incubation period, a period where we may not
Yes,
see symptoms.
exactly.
Yes. So that's the reason for for the quarantine actually, so that we'll be able to be sure that virus is not, and of course, I believe all the necessary testing, would also be done. So yes, everyone has a role to play. Uh, in a way, this is now contained in that particular ward where that patient is. That's the reason why they were able to, trace and track those that would be quarantined. But we still need to go back to the hostel where it's coming from so that it's dealt with from the very source. And we are sure that we are not expecting cases still to still spike in that particular region. Yeah. So I think those are measures that we have to put in place um in that in that regard. We should have mercy because people move from Ibadan to Lagos every day. Is where
It's not just the Lagos to Ibadan movement. It's And that's why I asked the question earlier on that why is there not so much focus um on human to
But
human
we're saying the
communication of
same.
the
We're saying the same thing now. I'm saying the contact tracing has to be done so that yeah, so that we can be sure that someone is not carrying something somewhere.
I just want us to be very sincere, right? If it's a female hostel, it's very different. Now that I say it, I don't know the gender of the person, right? Just to be very careful. But really, you know, this time now we have world recognized systems that actually encourage eating out, you know, the
I can encourage
24
what?
hours
I didn't get that.
eating out. What I mean by world recognized
Eating out.
system is you have
Okay.
apps like Glovo and CowDog. Thanks to them, they
Okay.
have made it very easy for people to actually, skip skills and get food. But you know, you don't know what's going on behind the back where the food is being prepared.
Of course.
You don't know, maybe
Of
somebody
course.
who is preparing it is infected, all of those kind of things. So people eat out a lot nowadays compared to some of the things you will have back then. One. Two, it's a student environment. Really, that's another thing to put into consideration. And before all of this eating out, our means of getting food from the market is also a point of concern because we get food from, the way food are transported from one point to another and all of those things. So really, I felt like, okay, yes, the rodent is something, but if an human comes in contact with it, now this is linking me to my next question, which is because everybody's immune response is different from one another. I can have a stronger
Yeah.
immune response. Mr. A can have a stronger immune response compared to Mr.
Yeah.
B. Do you
Yeah.
think this plays out in this kind of situation? I feel like for us to be able to really, really take care of the rodents to the human source, we also have to pay attention because the percentage of rodent to human interaction compared to human interaction is way higher. Human interaction is way higher
Sorry,
compared to rodent
I,
to
I,
human
I didn't get
interaction.
that.
I think, okay,
Okay.
what I'm trying to say is
Okay. I
the
think,
amount of people
yeah,
I will come in contact with in a day is more than the amount of
I get what
rodents
you
I will
mean. I
come in
get what you mean.
contact with in a day.
Yeah. Yeah.
Yes, exactly. And so imagine I'm on a bike
I'm
and the
conducted.
bike
Yeah.
man is
That's
sweaty.
great.
Because he said bodily fluid. Let's say the person might not get to the point of maybe the person is sweaty, and the Hausa guys they salivate a lot. They just do pwa everywhere, and you don't know, just different things like that. And you might be sitting in for example, the way, sorry to say, in this part of the world, we believe things
Yeah.
have changed, right? Because we have to paint the positive picture of what Africa really is. But in certain situations, you still see certain people
Yeah.
when they are pressed, they just try to help themselves by using the
Yeah.
closest drainage they can find
Roadside.
to ease off themselves.
Mm.
And in that moment, you don't know, maybe one woman is carrying food from one place, something pour on the floor, something happened, and they are cooking. Then they want to make profit, they will pack their meat, but you don't know what. So you just have different scenarios like that. Really, I feel, and that's I think I asked the question earlier on as regard that. For me, I feel it's not just the rodents. I feel we our how we do our day-to-day life actually has a whole lot of ripple effects, not just the rodents alone, right? What I mean is, for example, um, if people
Yeah.
so urine is not really a concern. Some people even urinate in bottles. Just very, very funny things, right? We have all of those. because to be sincere, okay, so let me just do the trends. Some of the things I did: rodent to human to human ratio, and doctor to patient ratio. So doctors go on for one thing, about five doctors will interact. Let's just assume, right? On an average, this person knows, "Oh, this is my doctor." Well, the person would interact with, let's say, an average of 3 to 5 doctors, not including the lab technologists or the nurses and all of those kind of people. So for me, I feel the human to human ratio is is more than the ratio to human ratio. And I don't know, I feel like I need to dwell on this, on how can, because if it is COVID, well, we know it is communicable, it is
Airborne.
communicated through the air, right? Is airborne. So I can just get a nose mask and I know I'm safe. But this one is bodily fluid. Anything can be bodily fluid. It can be my sweat, it can be somebody's saliva, it can be somebody's urine, it can be somebody's feces, both from the rodent or human, whichever one. So this particular, I cannot say people should not touch me. Like I'm on the bus, I'm in a Lagos bus and somebody's telling me shift, shift, shift. Am I saying the person's sweat will not touch my body?
Yes. So, but of course, I agree with you 100%. People talk even in the bus. Okay. But then again, but then again, that's why each one will need to take responsibility for their health. Are you still there? Hello? Okay. But then again, that's why each one needs to take responsibility for for their health, because like I said, the doctor will not how do I explain this? The very first point is from these rodents. A human will not have it if he did not come in con if he has not come in contact with a rodent directly or indirectly, if you understand what I mean. So for a patient to come to the hospital with Lassa fever symptoms, the person must have gotten it from an infected, through an infected rodent that has maybe tampered with, food or something like that he has eaten. If you understand what I mean. So that is where we should still focus on. Yes, once those patients now present to the hospital, okay, it is now kind of contained, okay, and then we can now begin to trace and identify, those who have come in contact, okay. However, we must not forget where it came from. That is where we should. That is what we should deal with. And then you spoke about immune system. About 80% of persons. That's another thing that we should know. About 80% of people actually have mild or no symptoms at all. So they do not show symptoms, or the symptoms are very mild. So maybe they just have a slight headache or something, and it just goes. Okay, those persons, uh you can say their immune system, is able to really combat and hold the virus. But in some cases, in some cases, about 20% of the cases, it's usually not so. The virus overcomes and then replicates and does damage. If you understand what I'm trying to say, okay. So yeah, that's what I'm going to say about immune system.
Hello?
Yeah, I'm still here. I'm still here. Can you hear me?
Yeah. All right. Although like the network was breaking right at my own end, so
Okay, so I need to retract. I need to retract. I need to adjust what I said. So I just confirmed now, and sweat is actually one of the means. Is actually part of the. Can you hear me? Sorry.
yes, okay.
Yes, I said I just confirmed now, and sweat is actually part of the bodily fluids that through which one can contract. That's the human to human. So that's actually worthy of note. Apologies for the misinformation earlier. So sweat should not be overlooked.
Okay. Sorry, please can you summarize everything you said? The network was breaking up.
Okay. Yes, I can. So
Okay.
I was referring to the mode of transmission. We spoke about the contact and bodily fluids. I
Yeah.
said sweat. I just confirmed now, and sweat is actually one of the means through which one can come in contact and get this virus. Okay. So not just saliva, not just urine, feces, but even contact, that's even sweat. That means, of course, touching is also will also predispose one to contracting this virus. Of course, we've spoken about foodborne and fecal oral routes and all of that. So yes, take note of
Okay,
that.
so I want us to touch on the immune response part. I think we are yet to. I mean,
Okay, I spoke about it. I spoke about it. Maybe you didn't hear. So the everyone's immunity varies, right?
yeah.
And um, that is one of the reasons that accounts for the 80% of asymptomatic cases. What that
Mm,
means is that people with the virus not manifesting any symptom clinically, about
mm,
80% they have mild or no symptoms at all. Um, Whereas the other 20%, whose immunity or whose body are not able to overpower the virus overcomes and then replicates and does damage. And then that's where we begin to have those symptoms that can now become severe, leading to death. You most of the time would actually lead to complication, especially um, if not quickly attended to, because it affects multiple organs. It can affect the lungs, affect the respiratory system, affect your blood cells, affect uh, if it affects your blood cells, then indirect automatically your kidneys become affected too. If your blood is depleted, your heart begins to overwork. So you see all the problems begin to, and it happens very fast because the virus we are talking about here. So yeah, immunity is
mm.
important, but we don't have any immunization, any vaccination for Lassa fever yet, anyways. So perhaps that may be the what now, a breakthrough that would actually need
Mm.
in this part of the world. Mhm. Just like we have malaria vaccine now.
Yes, I discovered that there's a drug for so most of them. Let's not even really move into pharmacological and all of these things. I think I will ask my questions all in one. So the first thing is the preventive measures that we have available currently now in this part of the world. I mean, not all futuristic. I mean, what do we have on ground as something preventive measures people can take, right, to protect themselves from the Lassa fever virus? The secondly is this diagnostics you mentioned on PCR. They have to do a PCR test um, for them to be able to identify if it is a Lassa fever or it's not Lassa. Is the Lassa virus
Yeah,
or not? Is this
yeah.
something affordable for the general public, or when it comes to affordability, right? I think it's something to consider, right? Because everybody is for everybody. General public, see now, I'm asking doctor, is it a is it a test that everybody can easily walk in and just say I want to diagnose, I want to run a diagnostic test on Lassa fever, because we have to also consider cost and affordability for people. Is this something people can
Yeah.
easily just afford? And if I think that's my second question. Okay, so let me ask
Okay.
this two first. I think those ones will now lead me to how I would ask the next ones. What's the time?
Okay. Okay. So the first question is the practical means through which we can prevent this. It's actually cheaper to prevent. Okay, and this has to do with hygiene, personal hygiene, food hygiene. That means you must take responsibility for how you store your foods. You must make sure that it is safe and not within the reach of any kind of rodents at all. And this is not, that means the practice of just spreading your foods and yeah, because you want them to dry or something, you want the sun to dry them, and so you just spread them on the floor. And rodents have access to this. Your environment, you know where you stay, and then you still spread. So that should be avoided. Instead, it should be properly stored in containers that can be sealed, that have proper covers. Rodents cannot have access to. Okay, and personal hygiene too, like hand hygiene, washing your hands. Maybe when you come into the house or even before you get into your home, you wash properly, and you know those things. And then you are also mindful of those that are living around you and the complaints that they make. It's funny, but this is actually a way of preventing at least the human to human. Okay, so
Mm.
you have the responsibility of telling, advising that individual to go for a check, to see the doctor, because you never know what kind of illness that person has. Okay, of course, if the person is now sick, you avoid contact with the bodily fluids of that individual. Okay, and that way we will be able to prevent. Those are the preventions that we have for now. If your your area where you stay, rodents, they're having a free day, then you want to set traps for them. Do it mechanically or physically. Make use of the chemicals, spray where necessary to make sure that those rodents are eradicated to the best of your ability. Um, Keep your surrounding as clean as possible, uh, and make sure that there is nothing inviting those rodents. So your
Mm.
waste the waste in your home, you dispose properly, you dispose timely. You're not piling up and accumulating something that can attract these rodents. Those are practical ways. We don't have a vaccine yet, like I said. So those are practical ways through which we, as humans, the general public, can prevent Lassa fever. Speaking about the polymerase chain reaction, Lassa fever PCR, I mentioned, it is the diagnostic method that is the gold standard. Okay. Um, I do not know about the price, In fact, I do not know how many facilities in Lagos State can actually run that test. It's not
Hmm.
a test that is quite easy to come by. Okay, so what the test does that it detects that virus in the blood, in the serum, okay? Detects the viral RNA. It tells us that this Lassa fever is present. Okay.
Hmm.
Um, it's going to be quite pricey. We'll actually need to check with labs, but those top labs should be able to do the test. But the cost, I honestly do not have the information about the cost. But best believe that it's not going to be cheap. And yeah, I mean the principle of economics apply here now. The it's rare. It's something you can't even you can't get quite easily. For example, the facility where I am, it cannot be done. It needs to be outsourced. Not only does that mean that you are going to require more time to get your results, it also means that not everyone will be able to afford it, if you understand what I mean. So, but because this is um, an endemic concern, a concern of public health, a public health concern, I believe there will be instances and situations where these tests will have to be done, maybe supported by the community or supported by the institution, because it's a deadly virus, it's an endemic that needs to be urgently addressed. So it is highly specific, 100% specific and sensitive. So if it is positive, there is no going back. We know that this individual has Lassa fever. So yeah.
Thank you so much. So, we can all hear what the doctor said, right? I feel um, personal hygiene, just ensure them to help your. I think also less of eating out. I think we are because there are a lot of eat outs right now nowadays. So less of eat out. If you can cook by yourself, just cook in your house and be sure the source of where you are even getting your food materials from. Where you are getting your food materials from as well. So um have- I actually have um to some extent an adverse knowledge in manipulation.
Sorry, I didn't get that.
And I stick with doctors and also medical checkups once or twice, medical checkups. Just if you have a doctor friend, just reach out to your doctor friend, once or twice. And if the person will tell you, okay, I think you need to go to the hospital to, run these tests. So we just have to be up and doing, and I believe we're gonna scale through. So questions, I'm really close. Um, so can you
Yes, I can hear you.
okay, okay, thanks, sir. Yes, we're rounding up. We are rounding up, guys, and it's been a very interesting time. Before Doctor gives his last message, we want I want to remind you that health is wealth. Right? Please take care of your health, personal hygiene, right, and also sanitation of your environment. Be more one of the major modes where people even get this thing from is first through food, contaminated food, right? And exchange of bodily fluid. So we have to be more conscious and intentional now, right? And also, this is a message to our government, to the general public, right? And also to researchers, right? Developing a Lassa fever vaccination um, would be a go-to according to what doctor has said, would be a go-to
It
for
will
us.
be
Anyways, I
a
feel like the
breakthrough.
virus. Okay, it will be a breakthrough. Sorry for that. It will be a breakthrough for us. You know, for me personally, though, I think this is not a thing of what's personal to you, bro. This is a thing of public concern. So yes, let's have the vaccination. Right, not even a whole lot of people have can go can be able to go too far to say, oh, this is where I want to be getting my food from. This is not where I want to get my food from. This is what I can do. For example, somebody who is doing a white collar job, right, and is maybe, for example, a mechanic or a carpenter is far from home. Definitely, that kind of person has to eat out, right? And all of those back and forth like that. So you have a wide array of factors to actually consider in this topic. And vaccination would would be necessary as a matter of public concern, not what it is personally to me. Yeah. So Dr. wants to leave his last message with us as a roundup. So what's your last message for us? Really, what would you drop to the general public regarding Lassa fever? Should we relax and not get worried because everything is fine? It's not something serious like that, you know. Just there's no just it's what will be your last message to us in some minutes.
Okay. Well, thank you once again for having me. A lot has been said. A lot has been said since we started this podcast, and you should remember that although Lassa fever is deadly, infectious, contagious, it is also preventable. I think
Hmm.
if you are going to go away, if you would go away with anything, it should be that it can be prevented. And it can also be treated if it is detected early. So good personal hygiene, hand hygiene, food hygiene, environmental cleanliness, and just being aware that this um, Lassa fever is a thing, is endemic in your region, especially if you are listening in West Africa, is very important and it is very key to staying safe. So don't forget, you're taking responsibility for yourself, your well-being. You are indirectly taking responsibility for the well-being of those around you
People.
because this is contagious. You have rightly, spoken to the government. There are measures that have to be put in place to um, ensure that practices are not engaged that will favor these rodents from visiting the humans, then they should be imbibed. Healthcare practitioners should have a very high index of suspicion, especially in times like this. And I believe that we will be many steps closer towards um, having the occurrence of this virus, this Lassa fever, decline and sort of go down if we follow these practical steps. So once again, thank you for having me on the Biochain podcast, Lamide, and I hope that we'll see you again sometime in the near future. Thank
Yes,
you.
yeah. Yes, yes. So we are not done. Just a couple of minutes. So yes, I think yes, you made mention of something which is very true. There is treatment for early when it is early diagnosed. There is treatment for it. But because of there's no time, we actually made something of something that some people are asymptomatic. So it means some people can actually be carriers of these things and they themselves don't know. They move about, like normal human beings. Everybody's just there, back and forth. But really, from all of us at the Bell Trend Studio, right, I want to say very big thank you to you, Doctor, for gracing the meeting, right, with your knowledge. And yes, you were quite really very simple for a lot of us to understand. And beyond that was you brought in expertise. What we would have just said, oh, let's chat GPT, right? You give us an in-depth understanding of some of these things, right? And hearing it from a clinician, gives us a level of confidence that yes, this thing is preventable, right? And yes, we just need to all hands needs to be on deck, and as we are responsible when we are responsible for ourselves, we're also responsible for other people. So our last question for Doctor today is if it's a right doctor in the next 5 years, right? To
If
to
what?
vouch if I to invite you in the next 5 years to vouch and podcast, what is that new thing you want the public to know about you? What will be that new thing about you that is not for that that is known now? Well, maybe you'll be a father of the
Eh,
nation, or
ah, they are funny. So, so I hope to be by the grace of God. I hope I should have been a family physician by then. If the Lord
or
carries me coming, should have been a family physician definitely. Um, and I hope to be many steps closer towards the vision of leading a happier life, a healthier life, and
mm,
also really, reaching people and impacting lives through all the various tools and resources, privileges, and opportunities that would come my way. So yeah, amongst other things.
okay,
And
thank you
where
so much.
and what do you and what are we going to know about you in the next 5 years that we don't know now?
Well, I think I would be a great um I would be a great science communicationist, right? In this line, really helping people bring in what seems so far off, very close home, where they can
Abstract.
understand these things and you know, same thing
I love
impacting
that
life
you really
is so
it's yeah, not so many. I don't think that quite a number of podcasts that actually does this. So I think it's not just good for you to do it. It's actually needed. The general public need to, especially in this part of the world, they need to have access to this information, this knowledge, so that they can lead healthier lives the best way that they possibly can. So it's a very good one. Continue and keep it up. Wishing you all the best.
thank you. So these are the words of encouragement that we need. When you say people should drop comments, you not drop. We need the encouragement too. So I can keep on doing the good work. And thank you so much, Doctor. And yes, we'll be up on our games, and we believe that lives will be impacted, and people will make better decisions as regards their health. So thank you from all of us at God.
Thank you.
Voucher and your good night. Bye.